Welcome back, guys. Imagine this: a small cut on your finger, a simple fever, a routine infection, and suddenly nothing works. Not antibiotics, not medicines, and not even the strongest drugs that doctors have because the bacteria have learned to fight back. This is not science fiction, this is happening right now. And this invisible health crisis is called antimicrobial resistance AMR. And World Health Organization has already called this AMR one of the top global health threats right now. In hospitals, in villages, and in cities, the infections that were once easily treated has now again become deadly. Let me take you to a hospital ward. A young child is admitted with pneumonia, and doctors prescribe her antibiotics. Standard protocol. The infection doesn't respond. So the doctors switch to stronger drugs. Still no effect. Days pass, bills rise, and the hope drops. Here, the infection is no longer just an illness, it's a battle because the bacteria inside the child has become resistant. And a college going student gets fever, and without any diagnosis or any prescription, he walks to the pharmacy and buys antibiotics. He uses them for 2 days, and after that, he feels better and stops the medication. What he doesn't realize is this: he didn't kill the bacteria, he has trained them. Every incomplete antibiotic usage is a training camp for superbugs. What happened here? Antimicrobial resistance occurs when microorganisms like viruses, bacteria, and fungi develop and they become resistant to the medicines that are designed to kill them. So think of it like this: antibiotics are bullets, and the bacteria has learned to wear bulletproof jackets. How are we accelerating this? Overuse of antibiotics in humans and self medications without any prescriptions, poor infection control in hospitals, and use of antibiotics in animal husbandry and poultry. Now, let's ground this in reality. It is estimated that AMR was directly responsible for 1.27 million deaths in 2019, and when the associated deaths are included, the number rose to 4.9 million. And if this condition persists, WHO tells that AMR could cause 10 million deaths per year by 2050. We are not running out of antibiotics. Antibiotics are running out of us. Why is India particularly vulnerable to AMR? To answer this, we'll move beyond blaming and look at the ground reality. We'll start with something basic: access. In many parts of India, cities, semi urban, and rural villages, often local pharmacies becomes the first doctor. A person with a fever, cough, stomach pain, etc., they directly goes into the pharmacy and asks for antibiotics without any prescription, any diagnosis, because it's faster, cheaper, and more convenient. Now connect this with awareness. For many, antibiotics are seen as strongest medicines that will fix anything quickly. So they take it, feel better, and stop it. But this is where the damage begins because stopping the antibiotics in midway doesn't eliminate the bacteria totally. It selects the strongest bacteria and lets them survive. Then comes the structural reality. India carries a high burden of infectious diseases such as tuberculosis, diarrheal diseases, and respiratory infections, etc. More infections automatically mean the use of more antibiotics, and more use of unregulated antibiotics means faster resistance. It's not just behavior, it's the scale of the problem. Now look at the health infrastructure in India. Government hospitals are often crowded, and doctors treat hundreds of patients every day. In that conditions, what happens? Detailed diagnosis may not be happening, and antibiotics are sometimes prescribed as a precaution, not always a necessity. In areas with poor sanitation and unsafe drinking water, infections spread faster. This leads to use of antibiotics across the communities. And when the resistant bacteria enters the water, it doesn't stay at one place. It spreads over. Then comes the less talked about but critical sector: agriculture and livestock. Antibiotics are used in poultry and agriculture farming not only to prevent infections or diseases but for promoting faster growth. So, this enters the food chain and again into the environment. India is often referred as the AMR capital of the world in policy discussions, not as a criticism, but as a warning. Because what happens in India doesn't stay in India. We have seen this situation in COVID 19. Now, let's talk about the governance in India. India has created National Action Plan on antimicrobial resistance, aligning with the goals of World Health Organization's Global Action Plan. There are initiatives like surveillance networks by ICMR, guidelines for antibiotic use, integration with the WHO's GLASS system. But the gap is policies exist, but the enforcement is weak. Regulation of pharmacies is inconsistent, data systems are fragmented, and public awareness is limited. If AMR continues unchecked, the consequences are terrifying. It pushes the country back to the pre penicillin era. Routine surgeries will become risky, minor infections could turn fatal, and cancer treatments will become harder. Childbirth could become dangerous again. AMR will create massive healthcare costs, loss of productivity, and strain on public healthcare systems. So, what can be done? At an individual level, never take antibiotics without doctor's advice and never overuse it or stop the medication in the midway. Maintain hygiene and vaccine. At a system level, strict regulations of antibiotics use, strengthening surveillance systems, and investment in new drug research, public awareness campaigns, one health approach, integrating human, animal, and environmental health. Prevention is cheaper than cure. Now, AMR control is not a medical investment, it's a necessity. We are standing at a dangerous crossroads. For decades, antibiotics have been our shield, but today the shield is breaking. Will we act before it's too late or after it's irreversible? Because in this war, the enemy is invisible, the damage is silent, and the clock is already ticking. The next global health crisis might not come with a warning, it's already inside us. If you found this video informative, follow for DK Speaks. This is Darshan signing off for the day. DK Speaks. Thank you for watching.